So greetings everyone, I'm Jeff Nicochello Tejero, a level 3 nursing student from section D, and I'll be reporting about ischemic cardiomyopathy. So what we'll discuss today? Ischemic cardiomyopathy guide. So first is definition, the clinical manifestations, diagnostic tests, pathophysiology, surgical and nursing managements and interventions, and lastly is the prognosis. So next is the definition of the ischemic cardiomyopathy. So what is ischemic cardiomyopathy? Ischemic cardiomyopathy is a condition described as the heart does not pump well. This is due to ischemia. Ischemia is a condition defined as the inadequacy of blood flow or blood supply. Particularly in the case of ischemic cardiomyopathy, the focus is in the inadequacy of blood supply to the cardiac muscles, leading to ineffective cardiac muscle contractions. Coronary artery disease and heart failure or heart attacks are what causes the weakness of blood supply, which can lead to it weakens and enlarges the left ventricle in patients with ischemic cardiomyopathy. Okay, so for the clinical manifestations. So what are the signs and symptoms of a patient with ischemic cardiomyopathy? So first is chest pain, often after exercise or large meals, heart palpitations, dizziness, fainting, shortness of breath, swelling in your feet and ankles. Next are the diagnostic tests. First are the blood tests, ECG or electrocardiogram, chest x-ray, CT scan, MRI, and transthoracic echocardiogram. So next is the pathophysiology of ischemic cardiomyopathy. So first, endothelial dysfunction, there's a decrease in NO or PG1, an increase in ROS, and an increase in endothelin. This can lead to ischemia and can lead to pathologic remodeling, hypertrophy, fibrosis, and myocyte dysfunction, which can ultimately lead to ischemic cardiomyopathy. Next is the myocardial infarction and reinfarction, or also known as heart attack, which can lead to neurohormonal activation, which results in pathologic remodeling, hypertrophy, fibrosis, myocyte dysfunction. And myocardial infarction and reinfarction can lead to impaired relaxation and mitral regurgitation, which ultimately lead to ischemic cardiomyopathy. And lastly, the ischemia. Ischemia is defined as the reduced blood supply in the cardiac muscles, resulting in cardiac muscle ineffectivity in contractions. It can lead to impaired relaxation, mitral regurgitation, which can lead to ischemic cardiomyopathy. So the reason why there is a funnel, all this can be independent or dependent factors. They can work alone, which can result to ischemic cardiomyopathy, or they can work as one, hence the funnel pointing towards ischemic cardiomyopathy. Okay, so next are the nursing interventions. So first is to assist in self-care while promoting independence when tolerated, schedule interventions with periods in between, monitor for an increase in incidence of activity intolerance, such as patient can be easily fatigued. Next is encourage the patient to adhere to a graded cardiac rehabilitation program. So next are the surgical managements. Next, first is angioplasty, stents, coronary artery bypass, and lastly the surgical remodeling or reconstruction of the left ventricle. So for the last part are the prognosis. Depending on your situation, your heart muscles damage could be mild or severe. Medications help your heart work better and ease your symptoms. But if these are not enough, your provider will recommend procedures or devices to improve your health. That is all. Thank you.